For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good morning, everybody. My name is Ricardo Romero Morales. I'm a lead public information officer for the Emergency Operations Center in Santa Clara County. Today, we're gathered here to announce the first mobile vaccination clinic focused on the frontline workers here at Monterey Mushrooms. Today, we're honored to be here with the following speakers. Dr. Sara Cody, Health Officer and Director of Public Health in the County of Santa Clara. Dr. Marty Fenstersheib, COVID-19 and Vaccine Health Officer for the County of Santa Clara. Supervisor Cindy Chavez, Santa Clara County Board of Supervisors. Bonita Rivera, from the National Vice President of the United Farm Workers. Then we have Diana Telsford Torres, Executive Director of UFW Foundation, and Sarhib Sahad, an employee of Monterey Mushrooms. We also have Sahad Kasemi, CEO of the Monterey Mushrooms, and we also have Mayor Rich Constantine from the City of Morgan Hill. We will begin our press conference in English, followed by American Sign Language. We would also have a questions and answer period in where speakers will repeat the questions back in English for the purpose of our Facebook Live audience. After that, we will be moving into a Spanish segment in where we will also have Spanish speakers. Right after that, we'll have statements from the podium in Vietnamese, Chinese, and Tagalog. Without any further ado, it is my honor to introduce Dr. Sara Cody.
Good morning. I'm Dr. Sara Cody. It is a real pleasure to be here at Monterey Mushroom and to see everyone here getting vaccinated. Today marks the first day of the county's expansion to offer vaccines to people who work in critical frontline roles in food and agriculture, in the education sector, and in emergency services. And thanks to a wonderful collaboration between the county, the United Farm Workers, Monterey Mushrooms, and the United Farm Worker Foundation, we will be able to provide vaccine to approximately 1,000 farm workers this week through the clinic today, as well as another clinic taking place on Wednesday. Our goal in the county is to make sure that everybody has access to vaccination when they become eligible, and especially those who are working in sectors that have been hardest hit by COVID and who are working in communities that have been hardest hit by COVID here in our county. So combined with the mass vaccination clinics that we already have, our community-based clinics, and many outreach efforts, these mobile vaccination clinics that come to community, that meet people where they work and where they live, this is how we will get ourselves out of this pandemic. We are hearing more and more each day about these vaccines. They are safe, they are extraordinarily effective, and we now have 3 of them. They give us hope. I want to say thank you to all of the organizations that have made this possible, and I particularly want to thank the workers, the farm workers, all of the farm workers, and those who are getting vaccinated today, to extend our appreciation for the work that you've done throughout the pandemic for ensuring that we're nourished and that we're fed. This is a wonderful day. I feel hope. I want to thank everyone, and I just want to say on a personal note, I'm here today with the original members of my public health family. They are all here. And so next I want to introduce Dr. Marty Fenstersheib, who has served throughout this pandemic, who has been my mentor and is the previous health officer for the County of Santa Clara. Marty?
Thank you, Dr. Cody. I am so thrilled to be here also. This is just wonderful. It just shows you what a community-wide effort can accomplish. And we are very happy that we have been able to work with the United Farm Workers and Monterey Mushroom staff, and we're so happy that all the workers could be here today. We have done an amazing job, I think, as a community. We've started vaccinations in late December. Here we are about 2 months later, and we have vaccinated nearly 20% of our county. That's quite amazing. We have been able to also to vaccinate and outreach to our seniors, 65 and older, and we are nearing 60% of our seniors being vaccinated. That will go a long way at decreasing the number of deaths in our community and our hospitalizations, and it will make it safer for all of us. We hope that with additional vaccine, which is what we need, we have great capacity, we have lots of clinics, we have providers all over the county. We just need more vaccine, and we're hopeful that we will see more vaccine come through the state from the federal government to us, especially now with the third vaccine from Johnson & Johnson being authorized by the FDA. But I do want to remind everyone that as you are waiting for your turn to be vaccinated, to please continue to wear your masks, stay socially distanced, and be very, very cautious about being in large gatherings and groups of people. So be safe and be healthy when your turn comes to be vaccinated. And please get vaccinated when your turn does come. Thank you. And I want to turn that over to our Supervisor, Cindy Chavez, who will add her remarks.
Well, good morning, everyone. I wanted to take just a minute to walk everybody back to when COVID-19 very first struck us. And you'll remember that at that time we were worried about shortages of food and access to grocery stores and all of that. And one of the things that highlighted was that the people who were doing the hardest work, picking the fruit, processing in plants, were the most hard hit by COVID-19 and continue to do so. There was a lot of talk about how we honor our frontline workers. But the best way we can honor our frontline workers is what we're doing today, which is getting them vaccinations. That's the celebration that I think so exciting about today. And I want to acknowledge that one of the challenges we have to get deep into our communities is we need to do place-based vaccination like this. We need to go door to door. We need to make the phone calls to remind people to sign up, and we've got to get them here for these vaccinations. One of the best ways we can do that is partnerships. We have many of them. Monterey Mushroom is an extremely important partner, as being one of the largest union farm worker employers in the country, which is very exciting to us at a local level. The United Farm Workers, which have been incredible partners, making sure that people in the fields have the message they need to stay healthy and safe. So it is really my honor here to say that we're honoring farm workers the way we should, which is making sure they're getting vaccinated. With that, it's my great pleasure to introduce one of the leaders of the labor movement and the National Vice President for the United Farm Workers, Bonita Rivera.
Is this, Hi, my name is Bonita Rivera. I'm one of the National Vice Presidents of the United Farm Workers. This is a great start to getting farm workers vaccinated. It's really important that we see farm workers as essential workers and we treat them that way. We need to collectively get the vaccines to farm workers instead of having farm workers go and seek them out. And this is a great example of a collaboration that works with the employer, with the union, and the county prioritizing farm workers. Thanks to the county, we've been able to prioritize farm workers. Thank you. Next up is Diana from the UFW Foundation.
Thank you so much, and good morning, everyone. First and foremost, I want to say, si se puede. We are finally vaccinating farm workers in Santa Clara County. It's incredibly exciting. I'm Diana Torres. I'm Executive Director of the UFW Foundation, also a National Vice President of the United Farm Workers Union. And just want to say thank you to Shah Kazemi, CEO of Monterey Mushrooms, for having this event here today and on Wednesday. Monterey Mushrooms is hosting vaccination events, not just for employees of Monterey Mushrooms, but also for farm workers from throughout the county. And I must say that Monterey Mushrooms is not only hosting today, but they are also showing the example of an exemplary company that treats its workers with dignity and respect every single day. So I just want to express my gratitude for that. In addition, thank you so much to the County of Santa Clara. I must say that it's exciting to have Supervisor Cindy Chavez here with us today. And we also have Mayor Rich Constantine from the City of Morgan Hill, Councilmember Ivan Martinez Beltran, thank you so much. Councilmember Rebecca Armendariz from Gilroy. We're going to be in Gilroy soon. Councilmember Claudia Rossi, also County Board of Education. Thank you all so much for your support of the vaccination of farm workers. It's incredibly important that we make events accessible to workers. The UFW Foundation, as a sister organization of the United Farm Workers Union, is working very closely throughout the state with the union to ensure that we're helping farm workers access the events on the ground when the priority status gets triggered in that county. I must say that up until now, it's been a challenge to get counties to actually start to trigger the farm worker priority. But Santa Clara County is showing us how it needs to be done throughout the state. So I'm so excited that this is happening today. 1,000 workers, and it's going to be many more as we move forward in doing different events throughout the county, including Gilroy and other areas where farm workers live. I'd like to now introduce someone very important here, the most important speaker in my perspective, which is one of the workers here from Monterey Mushrooms, Sarjit Sangha.
Thank you. Thank you. Good morning, everybody. My name is Sarjit Sangha. I've been working with the Monterey Mushrooms 18 years. So I would like to say thank you to County of Santa Clara Health Department and UFW Foundation and Monterey Mushrooms. Thank you for.
Good morning, my name is Shah Kazemi and I work at Monterey Mushroom. I can tell you today is the happiest day I have had since last March. Today we are celebrating a significant event, and it's significant in so many ways. The most significant factor is the fact that our teammates and ag workers in the county are getting vaccinated. The second important fact is the recognition that finally this group of essential workers have received, and I want to express my gratitude to the people who work hard behind the scene, the UFW Foundation, UFW, Dr. Walter Newman, who really been championing the cause of vaccinating, starting with the flu vaccine. So this is a continuation of what we've been doing for many years and hope to continue to do so. But also I want to express my full gratitude to the county and all of their staff. Thank you very much for leading by example. That's what the other counties, other states need to do, because we talk about national security. The food supply is a significant part of national security, and we don't need any disruption in the food supply. And our teammates, the ag workers, have risked their life every day to make sure there is no disruption. So we are glad you are here to celebrate a new beginning, and thank you to everybody who came here to get vaccinated, and look forward to a brighter future as we go forward. Mayor Constantine.
Is that your phone?
No.
Well, thank you very much. And I would like to echo the sentiment of the previous speaker. Our appreciation for the county cannot be measured in words. Just last week, or earlier this week, the county brought their mobile vaccination clinic to Morgan Hill, again showing that the county is going to go to the areas hardest hit by this virus. And today, 1,000 farm workers are going to be inoculated in the next 2 days, today and Wednesday. So again, I wish to show our appreciation for the county, and again, want to highlight that the county is doing everything they can to get to the hardest hit populations in our county. Thank you very much.
All right. We will now move into questions and answers.
Good morning. Well, today, to be honest, I'm just thinking about today. I'm just thinking about today. And every single person who has been working so hard, to bring us food and to nourish us over the last year, and now has the opportunity to come get vaccinated where they work, that makes me so happy. So I actually wanted to be here today for many, many reasons, but some of them are just very personal. I want to see and feel the tremendous hope that we have here today. It's extraordinary, and I just want to soak it up. I just want to soak it up. The people that are getting vaccinated today can begin to breathe more easily. Their families can begin to stop worrying so intensely about them, and it feels so good. It's really extraordinary. So thank you for asking.
It does seem like as we've learned that this process has evolved, it does feel like one of the keys to effectiveness in getting the shots where they need to go is having the vaccine be mobile and moving to where the people are rather than setting up a big site and expecting everybody to come there. Is this an example of that?
Yeah.
Is this something that needs to go forward with that example?
Yes, we and by we I mean that in a very, very large sense. There are so many people and organizations in the we, and so what we have collectively tried to do is to offer vaccinations in many different ways, like all different ways, from mass vaccination where we can get a lot of people in because we need to vaccinate as quickly as we can, and very high touch boutique vaccination, so like mobile pop-ups. And this is our first big mobile pop-up where we need to come to where people are and reach them, and everything in between. And so we collectively, all of us here in partnership, are doing everything we can think of to get people vaccinated, and in roughly priority order, which is very challenging.
PCBS?
We will have more to say about that on Tuesday. Today is a day about vaccination. I think that we have talked for a year about this horrible, horrible pandemic. We've all had to make extraordinary sacrifices. We can't let up yet, but having these vaccines And as Dr. Marty said, now we're starting to make progress on a population level. We're starting to make progress starting today in some key communities. And this is a day of hope. This is really a day of hope.
Morganville Times? ABC? It's still COVID related, but it's a little off the agriculture topic, and that is today is the first day that classes of worship in Santa Clara County will be able to legally open. I'm just wondering if you have any comment or reaction to the Supreme Court decision allowing that, saying that Santa Clara has to respect that as well, and also what might happen with all the fines that have been levied against the folks that have violated it.
In Santa Clara County, we've tried everything that we have the power to do to protect our community. And it's been really hard. It's been hard for us, and it's been hard for everyone. I would still say I am quite worried about people gathering indoors because that's where we know COVID spreads. So what I would say to our whole community, if you do choose to attend an indoor gathering such as church, to please wear a well-fitting mask. Please keep your distance from people who aren't in your home. I don't want to. We're not at the finish line yet, and it's so important to keep protecting ourselves and protecting each other. I can't speak to that, but yes. We've been fighting this pandemic for over a year, right? We've been trying everything that we can for over a year. I think our community now is quite well educated, understands that this is very complicated. There are many risks and there are many trade-offs. I hope that everyone in our community continues to play it safe. And that means doing as much as you can outside, wearing your mask, and keeping your distance from people that are outside your home. That is the most important thing we can all do until we reach herd immunity.
We'll go final question from KCBS.
I would say in general, top level, it's quite extraordinary that just a little over a year in the pandemic, we have 3 safe and effective vaccines to offer. I mean, that is amazing. And with that, I think that as of now in the pandemic, if you're eligible for a vaccine and you're offered a vaccine, regardless of which one it is, take it. That's the top level message. The vaccines are different. The Pfizer and the Moderna vaccine require 2 doses, and they're kind of the same style of vaccine. The new Johnson & Johnson vaccine is single dose, and it's a lot less finicky. You can just keep it in the fridge. So that actually opens up a lot of possibility, which is very exciting. I think the top level message is we have 3 safe and effective vaccines, and when your time comes and you're offered, take whatever vaccine you're offered. Yep. I think that what we need to do is we need to try many different ways to reach communities, such as the Latinx community, that really need the vaccine and will benefit from the vaccine. I think there are many barriers, including we need to offer the vaccine when people are not working or taking care of their children. We need to offer the vaccine in partnership with community leaders. And we need to offer the vaccine in many ways, both where people live and where people work. And that's the reason for the design of these mobile pop-ups.
Thank you, Dr. Cody.
Thank you, Dr. Cody.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.